It has very much been a big part of this decade and has been a buzzword for mental health. And with good reason. The evidence base for mindfulness practice is very strong and is used widely in healthcare settings. The course, which runs 3 times a year, has been a fixture in the Hospice's calendar for a long time, even before it came into vogue.
Mindfulness has been used here at the Hospice for at least the past 10 years now. It began as a way of providing some additional support to people who had experienced bereavement. So we used mindfulness and mindfulness training to help people live with their grief and live with their bereavement. And over the years we've expanded the scope of the people who attend the course. So it ties very much in with the support services here. At the Hospice there is a bereavement service and a psychology service that work very closely together, and we use mindfulness within the one-to-one work we do. But there's something about mindfulness that it can be taught best and works best when you learn it in a group setting.
Paul, who regularly leads the courses, believes it's especially useful for those who come to the Hospice.
When they've experienced a bereavement, they will naturally be experiencing a lot of emotions from day to day, and there will be times when they may be very distressed or frightened, and other days when they'll be having more positive days, when they may be feeling more calm or connected with life. Like anybody, when we face difficult, adverse times in our lives, it kind of turns up the volume on the normal ups and downs of lives, and mindfulness can be a way of taking care of oneself and grounding oneself and managing those difficult emotions as they arise. I guess mindfulness can give us choice to respond, to take a moment and let our emotions settle and catch our breath, and then choose the way forward in a more measured way. That can be true of any part of human experience, but certainly when people are facing life-shortening illnesses or bereavement, or they're caring for somebody who's very ill, having these skills, these ways of taking care of themselves, is more essential than ever, I guess.
According to the experts, the main way of learning is through experience and involves a form of meditating by paying attention to the present.
A meditation would be as simple as we would get everybody to sit in the room and to have both feet on the floor, so they're kind of grounded and sat upright and relaxed in their chair, allowing their eyes to close, and then just asking them to tune into their breathing. So it's as simple as saying, become aware of your breath, but not thinking about breathing, becoming aware of the sensations of breathing. That kind of way of being, of just being still and using your attention to tune in to that experience that kind of anchors you to the here and now. It is just something we don't ordinarily do. So that is kind of how a very simple meditation would look like. But it can be the breath, or it can be sounds, or it can be the way you move as you make a cup of tea. Whatever it is, it's just simple, everyday ways of connecting with being present.
The course, which starts in May, is fully booked, but the next one takes place at the Hospice in September. This is Talika Pandey for That Solent.